You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Well, good morning. Today is question and answer. It's always a joy to answer questions. Okay, so good to have you on. I'm going to answer some questions. This morning that came in, we appreciate it. I'll try and, when I answer questions, sometimes it can be a little specific to one thing or whatever. I'll try and spread it out a little bit and make it more interesting. So someone was asking, actually I got this question the other day too, about 5G radiation, right? Like the 5G. Last year they installed in our front yard the 5G. I think it was Bell that was installing their wires for 5G. And what do I think of all that? Well, look, first of all, that area in terms of radiation or electrical grid or whatever, that's really not my expertise. I mean, I can read about it on the internet, just like you guys can. And I'm not that, I don't know, to be honest with you. I mean, again, it's not my expertise. Is it good? I listened to a doctor the other day say it's very bad because it, we are an electrical grid, and to some extent we're full of electricity. That's true. And this type of, he talked about going back into the 1920s or whatever with radio and then radar and then I can't remember what else he said, 5G and like we're getting now, and all of this electrical stuff is having an effect on us. Now I'm just going to give you my take, okay? My take on it. I believe that any of these things, okay, like 5G or whatever, welcome to the new world. I don't think, we can scream and shout and whatever we want to do. I don't think we're going to stop it. And I don't think you can get away from it completely. Okay? Like, where are you going to go where you're not going to get 5G? We all got a cell phone. We all got, there is definitely frequencies out there. And where are you going to go? You're going to live off the grid? So I tell people, look, this is where I come from. Look, do everything in your power to help yourself. And this is where I come from. I tell people, look, help your immune system. I'm a big guy on three things, because three things are at the root of all disease, in my opinion. Okay? One of them is high circulating insulin. I don't know about anything else, but I know that high circulating insulin is a major issue. And I know that high circulating insulin has to do with what you put in your mouth every day, food. So you can control that, 1. 2, leaky gut. Leaky gut is at the root of lots of problems. Leaky gut, leaky brain, leaky gut, leaky skin, leaky gut, leaky lungs, leaky gut, leaky everything, just about. So the gut is very important. 80% of your hormones are there. Fix your leaky gut. You don't want to have candida, yeast, fungus. We'll talk about it because one of the questions was talking about women and their bladders. I'm going to talk about that this morning. But guys, and the third one is oxidative damage. That's how we age. Free radical damage. We can slow it down. We can't stop it, but we can slow it down. So what are you in control of? Those three things. I think it's important that you do as much as you can to fix those three things. What can you control? What you put in your mouth every day. What can you help is your gut. Well, that has to do with food too, but also leaky gut and getting rid of yeast and candida. And, that's what you can control. That's what you can control. And oxidative damage, you can slow that down. And, and maybe where 5G is coming in is it's creating more oxidative damage, free radical damage. Well, lower it. You know, you're not going to get rid of it completely, but you can lower it by a real good diet again. Taking care of your diet. Guys, that's what you can control. You see where I come from? You see where I come from? We don't live in a perfect world, guys. Far from it, right? There's just things you're never going to get away from, you know? I was reading this morning about the, every day I'm reading about COVID-19, but I was reading about Italy, where they had a massive problem, obviously. And they're always comparing everything else to Italy because Italy got out of control. We closed the whole world down, not even over China, because China was first. The Wuhan, the city of Wuhan, the Wuhan province. But what like if you uncover the layers, let's talk about that just for a sec. Do you know that in Italy, in northern Italy, in the area it was hardest hit, had the worst air pollution in all of Europe? I didn't know that, did you? Yeah. China, the worst area. Well, that had an effect on people's lungs, didn't it? And by the way, like if I just read stats, and this came from the New England Journal of Medicine. They were skeptical of what was reported out of Italy because they said, this is guys, this is not me, okay? I'm just telling you what I read. The New England Journal of Medicine said, well, 80% of the people that died were over 80 years old and higher. As a matter of fact, 10% of the 80% that died, 10% were over 90 years old in Italy. You know, like the news don't tell you that. They're just chalking up numbers. And guys, look, I told you, I'm all for wash your hands. I'm all for self-isolation, and social distancing. And don't touch your face. If they tell me to wear a mask, I'll wear a mask. I'm going to obey the laws of the land. So don't come after me and say, well, Dr. Martin, you're a denier. I'm not a denier. I'm just telling you, let's get the truth. Let's get the truth. And I talked to you yesterday. And this is what bugs me the most is what they're not reporting are the underlying conditions. And the biggest one is diabetes. Even the New England Journal of Medicine said it. Nobody's talking about the elephant in the room. People that get really sick from this, generally, are old, very old, and people who are diabetic, and this is the other thing, I didn't want to forget it, that causes free radical damage. Smoking. In Italy, most of the people that got sick were smokers. And in China, men. Do you know that men smoke much more than women? Because they're trying to figure out why do men die of this more than women are dying of this. One of them, of course, again, New England Journal of Medicine. Men smoke more than women do. We're not talking about these kind of things. Okay? They closed the whole world stinking down. But they're not talking about that. Like the news cycles, you can't blame the news people. I mean, holy moly. Their ratings are through the roof. Okay, so 5G, I don't know. Is it good? Well, we live in an electrical grid now anyway. I don't know if we're going to be able to get away from it. So protect yourself, guys. That's all I'm saying to you. Very good question. Thank you. Somebody's asking about AFib and Wolff-Parkinson syndrome, which is a genetic thing, or, where you have a problem with the atrial fib, by the way. Let me just talk about atrial fib. Atrial fib is a huge problem in our society today compared to, I'm not kidding you, guys. I'm not kidding you. In the 1970s, I know atrial fib was around, but we hardly ever heard of it. But today, it's a huge problem. Atrial fibrillation, we say, you know what? This is again, I'm going to give you my little take on it. What Dr. Martin has seen. Most of the people, not all of the people, most of the people, they don't have enough CoQ10. Now, you never hear me talking too much about taking a supplement of CoQ10, because if you eat steak, you get CoQ10. Yeah, another reason to eat red meat. CoQ10 makes the heart muscle and the electrical grid work better. Magnesium is another one. 80% or so are deficient in magnesium. People are eating their carboholics. Do you know that when you have high fructose corn syrup, which is in everything, by the way, it depletes you of magnesium. It leaches the magnesium out of your body. This is why it's so dangerous for your kidneys. I always tell people with kidneys is not salt. It's not protein. Oh, Dr. Martin, protein. I got protein in my urine. Must be because I'm eating too much protein. No, because you're not eating enough protein and you're eating too many carbohydrates and sugars, especially high fructose corn syrup, which is the sugar of choice for the food industry. Why? It's cheap, but it depletes your magnesium. It depletes your chromium. You know what chromium is? Chromium helps to stabilize your blood sugar. I love chromium. I have it in my insulin formula. So, you know anybody with kidney problems? There's two things. One, they're dehydrated most of the time. Okay, again, remember there's my grandmother had kidney problems and she drank 2 liters of water a day. Okay, good for her. You know, and I have an uncle that's 98 years old and smokes and drinks every day. Yeah, but he's the exception, okay? He got the grace of God, believe me, okay? Because I love, all my life I've been treating people that are unwell. And usually people that are unwell they have bad habits. They're bad eaters, right? Usually, okay? So remember that. So atrial fib, in my opinion, and what I've seen and why there's so much of it today, people don't eat enough red meat to get all the vitamins. And we talked about it yesterday. We've been talking about zinc, right? And zinc is like, it's a superstar today with COVID-19, isn't it? Like even doctors are starting to look at the importance of zinc, but you get zinc when you eat steak. Eat more steak. I'm not against zinc. I took zinc this morning. You know why? Because I took my prostate formula. I'm 68 years old. I need a good prostate. And I have a zinc picolinate in our formula. So, good questions, by the way. These are excellent questions. I thank you very much. Someone is asking me about spirulina. I like spirulina. I do. Not on its own. Guys, let me just share something with you, okay? Because somebody asked me, and I forgot to answer it, actually. I think it was last Friday. What about, Dr. Martin, do you like milk thistle? Yeah, I do. Do you like spirulina? Yeah, I do. But not on their own. I'm a formula guy. Most, not always. It's like vitamin C. I talked to you about it. Even then, there's the new kid on the block. Really, they're starting to talk about vitamin C. But vitamin C, guys, if you just take a vitamin C capsule, like I took my vitamin C. You know what Dr. Martin's vitamin C is? It's coffee. But the other vitamin C, okay? The other vitamin C, here's my experience. On its own, no, I'm not against the intravenous. Well, good luck with that. Who's going to give you that? You're going to pay a fortune to get it put into your veins. I like it. As a treatment, I do. I think that everyone that has COVID-19 that's admitted to the hospital, the first thing they should pump in them is a bag full of vitamin C. But vitamin C only stays in your body 3 or 4 hours unless you hook it up with something else. This is why, for me, I always found that if you took vitamin C, and I like acerola, that's my favorite. If you take vitamin C and put it with pine bark, wow, stays in your body much longer. It's much more bioavailable. So when you ask me about certain things like spirulina, I like it. Spirulina is good. Not on its own. I have spirulina in our blood boost, okay? I like it, but I don't like it on its own. That's me. I'm a formula guy. Okay, I like formulas because guys, you got to understand, for me at the Martin Clinic, I have to get results. You got to get results. So I wouldn't take spirulina on its own. I wouldn't even take milk thistle on its own. Not that they're good for you, but in combinations, much better. Okay, that's where I come from. Okay, here's another question. Somebody's asking about Carrageenan. Is it Carrageenan or Carrageenan? Okay, in cream, 35%. It's a thickening agent. Now, it's a natural thickening agent. Now, look, you go online, it can cause inflammation. Louise, very, very good question, by the way. Look, let me just say this. It comes back to that 5G, really, okay? We don't live in a perfect world. Look, if, you know me, so if, for example, red meat, okay? You gotta understand that in a period of a week, with Facebook and everything and how this thing gets shared and whatever, in our emails, we're talking to hundreds of thousands of people a week, okay, at the Martin Clinic. And so I talk in generalities. You get that, you understand that. I talk in generalities. Is grass-fed beef better than grain-fed beef? Yes, it's got more omega-3. So if you can get grass-fed beef, get it, 100%. But you have to understand, from my perspective, I have to talk to people that, of all budgets, maybe they don't have the budget, or maybe they don't have access to get grass-fed beef. Well, I'm just going to tell you something. A piece of beef, a red meat steak, any steak, is better than a piece of bread. Got it? Any steak is better than a chocolate bar. Any kind of protein that you would take. Better to have a piece of steak than, a protein shake. I mean that. I'm not against protein shakes, as you know. I have Dr. Martin's Perfect Smoothie, okay? And my choice is bone broth protein. But protein powders, I like them. I'm not against them. I'm just saying, you got to eat anyway. So look, if you can afford it, you can be all organic. People that tell me they're all organic, I love you. Good for you. Happy. I mean it. It's better. It's not better for what's in it. It's what's not in it, right? And somebody was asking along the same line, very good question, magnesium stearate. Well, I'll tell you, in Canada, you have to put some kind of filler in capsules. You have to. Health Canada regulations. And they have to be approved by Health Canada in the United States by, the FDA or whatever. You can read negative stuff on it, but to me, it's not negative. Okay, so they're good questions. As much as possible. If you can afford it, if you can shop for the right, organic and no preservatives added and no fillers added, well, good for you. But those are rare. The thing I know about our manufacturers of our products, they're the best in Canada. They're the best. Because I've been doing this for a long time. And, I tell you, for a long time, I've put products in the clinic, and I'll tell you, they're the best in my opinion. And Health Canada has got so many regulations now. I mean, you can't produce any kind of vitamin or whatever today in Canada. I mean, they're probably the strictest in all of the world are right here in Canada, okay? So, anyway, I think you know where I'm coming from, okay? Carol was asking about a problem in her shoulder calcium deposit. And that's never any fun, a frozen shoulder or a shoulder. The problem with a shoulder or a hip is we call them avascular. Avascular means there's very little blood supply in the shoulder. Not a lot of blood up in there, okay? And the problem is if you get a shoulder problem, there's not a lot of blood to help repair it. So if you get a little tear or you get a calcium deposit or whatever, no fun. No fun, can take long time. And anybody tells you they can fix that in 5 seconds, there's liar, pants on fire. Okay? But, therapy, heat, I'm a big guy on heat. And not so much freezing it, heat it up. Because that brings extra blood supply to the area when you heat it up. So, lots of heat, passive therapy. I love our inflammation formula. I'll put it up against any inflammation formula with ashwagandha and curcumin and omega-3. And I put all my favorite anti-inflammatories in there. Okay, so it's a tremendous formula. I would use that because anytime you have pain, you got inflammation. You never have pain without inflammation. So, and someone was asking about the eye. I haven't heard this word in a long time. I've seen this, by the way, in the clinic. Blepharitis. That is just an infection on the eyelid. I've seen that quite a bit. I see it much more today than I used to. Guys, it's always fungal. I know there might be a staph on top of it, a staph infection or whatever on the eyelid, but it's always fungal. And it's from the gut. Yeah, leaky gut, leaky skin. And the eyelid is, it can get dry in there but you got to fix that candida. Let me bring this to the bladder too, by the way, because somebody was asking about women and their bladder. You know what, ladies, listen. The bladder, why do women have trouble with the bladder compared to men? Not that men can't get it, it's just that it's 90-10. Or it's more than that, probably. Why do women have trouble with the bladder? 2 reasons. Moisture, okay? Why do women much more susceptible to a bladder infection? Moisture, it's fungal. I know you can get a bacterial infection, for sure, I understand that. But there's always a yeast. Fungus, Candida albicans, that coats the bladder. And even if you get interstitial cystitis or whatever, it's always yeast. So you have to fix the yeast. Don't feed the bears. Don't give it sugar. And probiotics for the bladder. And secondly, so it's always fungal. There's always a fungus there. Always. Oh, Dr. Martin, I took an antibiotic. I know. And I'm not saying you shouldn't. But the problem is if it reoccurs, it's a yeast infection in the bladder. It's not bacterial. The E. coli or whatever will sit on top of the fungus. You have to get rid of the yeast. Okay? And that happens in the sinuses as well. Oftentimes in the lungs. The lungs, because of moisture, it's a perfect... I touched my face. I'm not supposed to, but I had an itchy nose. What are you supposed to do with that, by the way? I'm trying not to touch my face as much, okay? Not easy, okay? But you get that? Okay, so candida, yeast, get rid of that. And by the way, another thing for women, this is a huge problem with the bladder. If you have any kind of a little bit of leaking or whatever, women have a tendency to lose the elasticity in their bladder. Remember, your bladder is a muscle, right? And guess what makes that? Guess what makes your bladder, ladies, keep your muscle? Progesterone, hormonal. That's why a lot of women, they have trouble with that. Men don't have trouble with their bladder as much as we have trouble with our prostate. But women can have trouble with their bladder, and a lot of times it can be yeast or progesterone or both. A lot of times they don't have enough progesterone. And progesterone is ladies, Estrogen isn't your master hormone. Progesterone is. If you have stress, you have low progesterone. You can have. You have cortisol, it affects your progesterone, which affects your thyroid a lot of times because your thyroid won't even convert T4s to T3s to make your thyroid run at 100%. That's why so many women have a sluggish thyroid. Why do men not have a sluggish thyroid? I mean, again, guys, when I say that, I don't mean we can't ever have it. I'm just saying it's much more common in women because women have hormones. I'm writing a new book right now. I think Tony Jr. and I came up with the title the other day. Pretty sure we got it. I liked it, and it was coming out of him more than me. I liked it. But I'm going to talk about hormones, ladies. Hormones. Because sometimes, I had a lady in the office, I never forget, she said, Doc, I'm praying for menopause. I said, be careful what you pray for. Because menopause, not always pleasant if you have hormones and an imbalance. Because most of the time in menopause, women's progesterone sinks like the Titanic for a lot of women. And then they got a lot of issues after that with progesterone. Yeah. And doctors, God love them. But so often they're just giving women in menopausal years, they're giving them estrogen. Be careful with that. Makes you much more susceptible to breast cancer and ovarian cancer and uterine cancer. Estrogen is a growth hormone. I'm not big on giving estrogen. You got enough estrogen. This is a big problem in the world today. We have so much estrogen. Everything in your kitchen, just about. Anything that you can't pronounce. Any kind of chemical. Your body thinks it's estrogen, ladies. Why do you think there's so much breast cancer? Breast cancer, every breast cancer. Oh, doc, my cells weren't receptive to estrogen. You want to bet? There isn't a cancer cell that doesn't love estrogen. There's never a cancer cell that doesn't love insulin. This is why I always focus, guys. I focus. You must get tired of hearing me say it all the time. Insulin, it's a growth hormone. Estrogen, it's a growth hormone. And I'm not saying you don't need estrogen. Of course you do. You need estrogen. You're a woman. The problem is you get enough of it. It's the progesterone that you're missing. Anyway. Let's do a session on just hormones someday, okay? Because I might be locked down here. Guys, when are we getting out of jail? Our Prime Minister yesterday said nothing's going back to normal for 18 months until they find a vaccine. Wow. No, what's that mean? I don't know. You mean you can't go to a restaurant for 18 months? Can't go to a ball game? You can't go to a concert? You can't go to... I don't know what they're going to do, guys. Don't ask me. I don't know what they're going to do. I don't know what's going to happen in this crazy world. I don't know. So we might be doing this 5 days a week at 8:30 in the morning forever. I don't know. I don't know. I'm not making any predictions, okay? Because anytime I made a prediction about the coronavirus, I got it wrong because I never thought the world would do what it did to stop. But it did. In Canada, they were saying yesterday, don't travel. They were saying, don't even go out of Sudbury here where I am. Stay off the roads. You get in a car, I don't know how that affects. Anyway, don't get me going. You're going to just raise my blood pressure. I don't know. It's big changes, eh? Okay, let me just make sure I got all the questions. Good. Somebody asked about after reset, okay? Well, look, what do you do after the reset? 4 weeks, the reset. The whole book is, I'm giving the reason that the Martin Clinic developed the 30-day eating plan that we have. Now, you guys know me. I've been talking about low carb for so many years. Come on. You know me. I've been talking about that. I wrote a book, 10 years ago? More than that now? Serial killers, 2 hormones that want you dead. I've been talking about this for so long. But this is very specific. And what do you do when you come out of the reset? Well, look, One thing for sure, your metabolism is going to be completely changed. One thing for sure, you emptied out your liver. I can't emphasize that, how important that is. Because all metabolic disorders start with insulin, but insulin must store. That's a storage hormone. Remember, I just told you. It's a growth hormone. It stores in your liver. And guess what? You fix your liver in 30 days. It's fixed. Oh, Dr. Martin, I didn't lose any weight. Okay, but you fixed your liver. If you fix your liver, you fix almost everything. There's nothing more important than fixing your liver. Because I talked to you about it yesterday. Oh, this is another question. Is there any instances when you should be on a statin drug? Guys, listen to me. I'll never take you off of medication. I don't take you off of medication. It's not my job to take you off of medication. I just want to give you what cholesterol is. I gave you the truth yesterday about cholesterol. I hope you enjoyed that teaching on cholesterol. Okay? You can't live without it. It's not the boogeyman. Is there any way that any time you should take a statin? Hey, I guess so. You're just not going to get me. I don't like that particular medication. Okay? I like antibiotics. You need an antibiotic. I like them. If you got COVID-19 and you happen to be in the hospital and they want to give you the malaria drug, 100% go for it. I'm not against that. Gonna save your life? Go for it. I'm 100% for those things. I'm not against it. Do I like statin drugs? No. No, because they're looking for love in all the wrong places. They're lowering the wrong things, in my opinion. Okay? So guys, you guys were great. You asked a lot of good questions. Just make sure. Here, I wrote them all down. Hernia. Well, lactose-free cheese. Yeah, go for it. There's not a lot of lactose, by the way, in cheese. This is why I differentiate cheese from milk. Now, if you have a cow in the backyard, and by the way, even on the cream, I think you can get it without the, you can find it. It's not as easy and it won't last as long. The Carrageenan, right? You can get it without it, but it's not easy to find. Okay, but if you can find a look again, like I said, if you can find stuff, it's organic or whatever. You know me, I've always liked cream instead of milk, because milk should be cream. Whole milk. You got a cow in the backyard, drink the milk. Do you know it's against the law to drink unpasteurized milk? Well, I think you can do it personally, but you can't sell it. It's the way the world is, guys. Good luck trying to find. That's why I don't like milk. And they take all the fat of it. Anyway, I talked about that. Lactose-free cheese, absolutely. Any cheese is good. Okay, so thanks for the time this morning. Okay, so love you guys.
You've reached the end of another Doctor is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.